All right, thank you for coming today, everyone. I really appreciate it. I'm Todd Cortes, Head of Addiction Medicine at OHSU, and we're all here today to raise awareness about what every family needs to know about illicit fentanyl. Fentanyl is 50 to 100 times stronger than heroin and disguises itself as counterfeit pills that are widely available in teenage social circles. This has led to a 94% increase in unintentional poisonings and deaths among teenagers, particularly in our region in the last year. Our expert panel here today are set to talk about what parents, teenagers, and the general public can do to prevent more fentanyl poisonings in Oregon and Southwest Washington. With me here today are Jennifer and John Epstein from Song for Charlie. They live in Beaverton, Oregon, and are the parents of a child who died of a counterfeit pill containing illicit fentanyl. We have Joni Bush, a school nurse from Beaverton School District, who's coordinated staff trainings using naloxone to reverse overdoses in the schools. We have Dr. Anna Hildy to my right, an adolescent child psychiatrist who is a psychiatrist at NARA treatment programs. We have Dr. Olivia Ray Wright, addiction medicine physician and medical provider at Daybreak Youth Treatment Center in Vancouver, Washington. Sitting next to her is Tony Vizina, executive director of 4D Recovery Center and co-chair of the Oregon Alcohol and Drug and Policy Commission. And we have Dr. Nora Englander, Director of Project Impact at OHSU that initiates treatment for hospitalized patients with substance use disorders. We also have Dr. Bradley Buckheid, Program Director of the OHSU Addiction Medicine Fellowship. He also directs the Harbor Clinic that provides low-barrier substance use disorder treatment to people throughout the state. Let's start with Jennifer and John. Can you share a little bit about Cal's story and tell me what you've learned since then?
Great. Thank you for being here, everyone, and thank you for inviting us to be a part of this panel. Cal was an average kid. He was 18 years old when he passed away, and like many of the young victims of the fentanyl epidemic, we had not seen signs of substance use disorder prior to his passing. Cal was born in 2002 in the Cedar Mill area, in Beaverton area, and grew up with a typical childhood that you would see in our area. He did youth sports, kick and chase, swimming, wrestling. When he got into middle school, he realized that he was less interested in sports and more interested in theater, and got very involved in the school activities, the school plays, after-school activities, doing mostly the behind-the-scenes stuff. He liked to do the lights and sound and stage managing and that sort of stuff, and continued that through high school. He was very involved in that, also was interested in having jobs, so as soon as he turned 15, he got certified to be a lifeguard, and after a year or so became a beloved swim instructor of young kids in our community. He was active in a lot of things and successfully balanced school and work and after-school activities and all his friendships. His friendships were very important to him. He was always out with his friends, going to concerts, going to Dutch Brothers, Taco Bell, wherever, having friends over at our house. Very well known and liked in the community. Senior year, we realized he was using marijuana, had some discussions with him and talked about rules that marijuana was not something that we accepted in our household. Later, senior year, we learned that he was using marijuana to help stimulate his appetite because he said he had anxiety and was having a hard time eating. And so at that point, we got professional help, and we engaged with a psychiatrist and counselor, got him help. And also, that was the spring of 2020, so COVID hit. It was a hard time for him, but he was getting professional help, and he seemed to be missing his friends, like most kids his age, missing school, missing activities, but he seemed to be doing okay. He took responsibility for trying to be healthy and make good choices. He went and found a job at a grocery store so he could be out of the house, so he could see people, seemed to be on a good path. So in the fall of 2020, he went off to college. We thought that was a good choice for him, and he seemed to be doing well there. He went to University of Hawaii, and though COVID limited what activities were on campus and what school looked like, he was happy to be there and happy to be meeting people and be in the college setting. He came home at Christmas time during the winter holidays and was home for a couple days. He had a COVID test scheduled. We realized he didn't leave for his COVID test, went to find him, went to wake him up and found him unresponsive in his bed. And immediately called 911. John started CPR. Paramedics came. Police came, law enforcement, the sheriff who helped us. We saw a small bag of blue pills next to him, showed that to the sheriff, and he immediately said, these look like oxycodone, but they're not. They're most likely they're fentanyl, and if you're the praying type of people, I recommend that you start praying. And so that was the first we had ever heard of fentanyl. We didn't know anything about it, and Cal, he made it to the hospital, but he never recovered. We never saw him alive again, and our family was forever changed. Our immediate family, as well as our extended family and our community, is forever changed by his loss. And so that is why we are here. And since Cal's death, we have learned a tremendous amount about fentanyl, fake pills, and the deception that is going on by drug dealers. And we, in the months after Cal died, we approached Beaverton School District because we wanted to share Cal's story in the interest of making sure that our community was aware of this danger. And Beaverton School District did a fabulous job of creating the Fake and Fatal campaign, where they educated all of their middle and high school students with classroom education. They did a community conversation. They trained all of their teachers. They have naloxone in schools. Beaverton School District truly is a leader in fentanyl awareness in their schools, and I'm grateful to that. And since then, John and I have also begun working with Song for Charlie, and basically I full-time work for Song for Charlie now, spreading awareness at a national level. And so I'm going to pass it on to John, and he's going to talk a little bit about what we've learned.
Thanks, Jennifer. Thanks, Dr. Cortes, and thanks everybody for being here, and to OHSU for sponsoring this important session. This being here and getting this awareness and education is really important. It's what Jennifer and I spend most of our time doing. As you may know, Cal's story was not an isolated incident. Dr. Cortes mentioned some statistics. I especially want to just mention Griffin and Olivia's name. The Portland Public School students who we recently lost. My sympathies go out to the families and the Portland Public Schools and their communities. And there's so many others, Zach and Charlie and Madeline, and I could just go on with the names. We have come into contact with so many bereaved families with very, very similar circumstances. We do this work to honor Cal and also to protect others to be in order to not suffer the same fate. As Jennifer mentioned, we've been working with Song for Charlie, a national nonprofit, to raise awareness on this particular issue. And over the last year and a half, we've engaged with legislators and clinicians and law enforcement, district attorneys. Jennifer was in the White House last week talking to the drug czar's strategy staff. We have been all over this country, and most importantly, talking to many, many schools, educators, and students. So what I want to do just briefly is to share the 3 most important things that we've learned in the last year and a half that we think everybody should know. Number 1, this particular component of the opioid epidemic or the overdose epidemic is really new and different. And it is the combination of very powerful synthetic opioids and the counterfeiting and deception issue. You put those things together and you have a really lethal combination. These pills are everywhere. There's a hockey stick of growth of these counterfeit pills, and they can't be told apart, and they're not manufactured professionally, so there's an inconsistent and often lethal dose inside these pills. The DEA estimates 40% of the pills out there have more than 2 milligrams of illicit fentanyl in them, which for many users would be a lethal dose. Portland law enforcement and many other law enforcement agencies say they have not seized a legitimate opioid pill in their drug seizures in the last couple of years. This is not a prescription issue. This is not a medicine cabinet issue. This is something new and different. It is these counterfeit pills made with illicitly manufactured fentanyl. So that's number 1. Number 2 is that pill taking is all too common among our youth. It is a low stigma way to either self-medicate or experiment or recreate, and they really don't understand the risks. In our research that we've done nationally, we understand that only 1/3 of teenagers understand what fentanyl is. Those that think they understand what fentanyl is rate it about as dangerous as cigarettes, and a stunning 3/4 of teens are not aware of the issue of illicit fentanyl packaged into counterfeit pills. They're very easy to get over social media or from a friend, and the kids just don't know. We also know from scientific research that something called the perception of harm can be a very powerful a protective factor. And when the kid's perception of harm is different from reality, it's no longer a protective factor, it is a risk factor. And so that's why we feel it's very important to raise awareness and to change that perception of harm. The third item I would say is that this problem, solving this problem, will take time. We've engaged with many government agencies, alphabet soup of folks in Washington, D.C. and in the state and in other states, and the fact is that to provide evidence-based primary prevention requires research, and that takes time. To stop the flow of pills is something that I'm not sure we'd really ever be able to do, but it's a very complex and complicated issue. But what we do know is that raising awareness for youth in particular about this can significantly reduce harms, and that's why we don't think that this sort of a session would solve the problem, but could do a whole lot to save our kids, and that's why we focus our energies on that. So given that, the call to action that I would say around this issue is, first of all, for those of you, for everyone, to recognize that this is something that could apply to you. This is not just to someone else suffering a use disorder. This is not just to someone who's experiencing houselessness. All of those experiences are, of course, tragic, and we have great empathy for all of the 107,000 people that are dying annually from illicit substances. However, this particular aspect could really apply to anyone. So you need to recognize the youth in your life are at risk even when they might not fit a traditional at-risk profile. Secondly, and you're all doing it by watching this today, educate yourself. This forum, Song for Charlie, has great resources. There are some resources that OHSU will publish with this on their website. Please educate yourself and ask questions. And third, and finally, is multiply this message. Get it out as broadly as you can. That is, of course, with your family and friends and fellow students if you're a student watching this. As well as to your neighbors and colleagues and teachers and educators, because that is something that is really important to spread this message. So thank you for listening to our story, and I'm grateful to the panel for being here, and I'll turn it back to Todd to introduce the next speaker on the panel.
Thank you both so much, and really for your tremendous advocacy in honoring Cal's memory, and giving us all the opportunity to change our viewpoints and learn, so others don't face these consequences. Next, we'll have a question for Tony Vizina. Tony, how common is illicit fentanyl in Oregon, and what changes have you seen in your work at 4D Recovery, and who's using it?
Yeah, thanks so much. And I'll answer that question. I just first want to say that the time to take action was years ago, and we've known that we've had a problem with substance use disorder for a long time, and we've known that a three-pronged approach can work, which is prevention, treatment, and long-term recovery. I myself am in long-term recovery. I was a heroin addict. I'm coming up on 10 years abstinent-free this month. And, rewind 11 years ago, I had started my opioid addiction because of Oxycontins that had flooded the market. And when the Fed started to crack down on, what we called them back then were pill farms, but doctors who were over-prescribing, heroin took hold in the market, and that's been here for a really, really long time. I ended up losing my mom to opiates and other drugs. My dad's currently still using drugs, and I work with people all the time who are trying to figure it out, and families like the Epsteins come to me all the time, and I don't have a solution or an answer for them because Oregon is doing a horrible job at addressing a public health issue. My primary role at 4D Recovery is the executive director. I'm a co-founder of it. We don't do treatment. We hire people in recovery like me. They're called peers, also known as recovery coaches. And we inspire and instill hope in people who are struggling with substances to find recovery because it can and does happen when people are given the opportunity. The current market for the users that I primarily work with has changed a lot. People who are using heroin intravenously and stuff like that, they're no longer doing it. They're smoking what's called blues. And blues are a cheap, high-potency form of fentanyl that you smoke. And one of the problems that I'm seeing with these blues is they remind me of crack compared to cocaine. It's cheaper, it's really potent, and it wears off really, really fast. And so when you're addicted to opiates, you need to maintain having a supply so you don't get sick and go into withdrawal. It's something that I did for years. It's called staying well. And so we're seeing the market just flooded with blues. In addition, the pushers of fentanyl, they're using all sorts of different pills to hide their fentanyl in to appeal to lots of different markets. And John, you covered that very, very well, and thank you for doing that. And so people don't know what they're taking necessarily, but they know that it's cheap and it's easily accessible. Now, in addition to my job at 4D, where I employ about 50 people and we have recovery centers, we have 4 of them in the Tri-Counties area, I'm also the chair of the Alcohol and Drug Policy Commission. The Alcohol and Drug Policy Commission is a citizen commission where individuals are appointed by the governor and confirmed by the Senate to oversee alcohol and drug policy in Oregon. Our principal job is to create a strategic plan to address substance use disorder in Oregon. We have a plan, but one of the problems is there isn't a coordinated kind of executive effort in Oregon. And so what I would ask, is that you call your legislators, you call the gubernatorial candidates and you say, hey, we need a executive coordinated response that expedites the goals that we're trying to accomplish to address fentanyl and other substance use disorders. Because Oregon has some of the highest rates of substance use in the nation and the lowest rate to access to recovery services. And you see it every day when you leave your house, and it will impact your family. If it's not today, it will be soon. Thank you.
Thanks so much for that perspective, Tony. Joni Bush, as a nurse in the Beaverton School District, what are you seeing among the kids in your schools?
Boy, the landscape has changed dramatically ever since fentanyl has become part of the drug landscape. What I have been acutely aware of is the fact that if I'm responding to a student who is showing symptoms of a possible drug use, substance abuse, but may actively show symptoms of reduced level of consciousness, difficult to arouse, difficult to awaken, slow to respond, I often feel this internal panic that perhaps I have a student who has taken a pill that they believe was somewhat harmless. Oxycodone, Vicodin, Xannies, Perks. And so my assessment is entirely different for a lot of our students that I work with. I have kids that will bring a student to me, their friend, hugely worried about them in that moment, and also, explain that they're concerned about the drug use that they are participating in outside of school hours. And that's my opportunity to go in and have a conversation with the family, the student, and thank those other students for bringing that awareness and attention to myself. That is what I feel is most important right now, is to, again, in the same breath that the Epstein family is carrying that message, but that awareness that this could be your child, this could be your friend's child, this could be a family member. Fentanyl is something that has been infused in an incredible amount in almost any drug that we could purchase off the streets. So it could be powders, it could be marijuana, it could be, most importantly and most commonly, pills. No pill is the same. So testing one pill means that the next pill is not safe. The only pill that could be considered safe is prescribed from your physician and comes from a pharmacy. There is just too much of a risk for our students and our families, our cousins, our kids, our friends, to experiment, to be that naive user, to take that risk. It's a different landscape from years ago when I first started school nursing, where we had students bring in, mom and dad's vodka or pills from the cupboard. We were concerned about vape pens, incredibly. A few years ago, we were trying to damp down that and had public awareness and campaigns. I am proud of Beaverton School District for, in our community involvement program that put together the Fake and Fatal campaign. It's an awareness campaign. It's available for anybody to review, to copy, to use. And I actually, even as a medical professional, had no idea the amount of fentanyl and in illicit drugs that existed, that were out there, ready for the next unsuspecting individual. So I actually listened to Cal's story, and that was the beginning of my journey of understanding what this risk is. Beaverton School District also has adopted a school board policy that has instituted policy training and awareness for our students and staff and community members for fentanyl. And I've personally trained my high school and middle school staff for naloxone administration, because there is nothing more frightening than responding to a medical crisis and not having the tool to be able to reverse that opioid response, that deadly decreased respiration, decreased level of consciousness, which will end up in death. So that is something I'm proud of. Because of this push and this understanding, because it's a national trend, it's not just Oregon. Oregon does have quite a, our numbers have scarily increased at an alarming rate. But Oregon Health Authority and Oregon Department of Education have come together and published a toolkit that it's developed for fentanyl and opioid response toolkit, and that is meant to serve school districts. So again, chock full of wonderful information that we have wonderful platform, within our schools to be able to disperse that education. I would encourage any school district within Oregon, outside of Oregon, to take a look at the toolkit that's available online. It's very well done. And I also would recommend taking a look at the fake and fatal information on the Beaverton School District website, as that's available for families to view and educate at home. And please talk to your kids. Kids, talk to your friends, okay? One pill can be fatal. With the amount of fentanyl, that's just 2 grains of sand. It is tasteless, it is odorless, and there is no way to know that it's part of your drug of choice for that day.
Jody, thanks so much for giving us a window into our schools. I appreciate that. Dr. Hildy is an adolescent psychiatrist who understands the inner workings of the teenage brain. I'm hoping that you can talk to us about what's different in the decision-making process and how that translates to risk-taking behaviors for kids.
Absolutely. First of all, I just want to thank everybody for being here, and I'm very honored to be part of this panel. This is a group of very knowledgeable individuals, and this is an extremely important topic. This is something that I deal with professionally every day, but I just want to mention this is also very personal for me. I am an individual in long-term recovery from opiates, from heroin, and my experience with substance use and with heroin in particular is completely different than what I'm seeing with the youth today. Fentanyl is different. It is a different beast, and it is absolutely vital that we do what we're doing here today, and we really need to be pushing for policy changes, and our state can do better, and it needs to do better because young people will continue to die. So I just had to say that before I jump into to the brain. So I think really what is important to know is that an adolescent brain is different than a children's brain and an adult brain. And when I say adolescence, we really think about that as a time period from sort of the teen years all the way up to the age of 25. That is when the brain is still really developing. And so there's this huge amount of neural development that's taking place. The neurons are increasing. There's this huge brain growth. There's also a lot of pruning, and what happens is that makes the brain particularly susceptible to stress, right? There's this active developmental process that's taking place. So when there are external stressors, external substances that are impacting the brain and brain function, it has a huge impact. But beyond that, when we think about teens and behavior, right? So there is a biological element to what we see, right? A lot of people talk about, right? And parents will say this, they're like, I don't understand what happened to my kid. Like, they were this great kid and suddenly they're a teenager and they're like out of control. And they don't listen and they act impulsively and it's like a whole different person. Well, it's because their brain is different. So what is happening is the amygdala, which is the part of our brain that's really the emotion center, it's quite reactive, that develops much more quickly than the frontal and prefrontal cortex. And this area of the brain is about planning. It's about thinking, pausing, right? I think about it as like controlling reason or reasoning. And I actually talk about it a lot like it's the brakes. It's the brakes in our brain, right? We like have a thought, and before we go to the action, that frontal cortex goes, let's check this thing out. Yeah, that's not happening very well in the adolescent period. So what happens in terms of behavior? So an adolescent is more likely to be impulsive, engage in risky behavior, misread and misinterpret social cues, less likely to think before they act, to pause, and even to change behavior. So we have this perfect storm or setting of high reward seeking and risk taking in the setting of poor impulse control. And this ties into what John was talking about earlier, this sense of invincibility, right? And some people refer to this as optimistic bias. So it's not going to happen to me. That's going to happen to somebody else. And we are seeing a lot of evidence and some studies coming out that young people really do not understand risk, that their thinking about risk is really limited. And so again, it's not going to happen to me. And we see this both in that kind of idea of the novel risk taking, like I'm at a party and there's alcohol, or there's some pills. Well, I've never used it. I'm just going to take it one time. It's not going to hurt me. But we're also seeing this in terms of this perception of any development of dependency. So again, I'm just using a few times. That's not going to happen to me. That's what happens to people that are homeless. That's what happens to other people. So that's kind of an overview of kind of the biological aspect and brain, but I also want to mention that at the same time, right, that there's this psychosocial element, and because I'm a psychiatrist, I'm just gonna talk a little bit about Erikson and sort of developmental stages, so, because I have to, because I'm a psychiatrist. So during this time period, right, Erikson talks about identity versus role confusion. So what does that mean, identity? Like, who am I? How do I fit into the world? What do I like? What don't I like? So by definition, right, this is about experimentation. And that's what we want, right? Like, I want the youth to go out there and check things out, try things on, what fits, what doesn't fit. But again, it leaves them very susceptible and at risk, particularly in this environment that we're in and when we're talking about fentanyl. Does that mean that this is hopeless and we throw up our hands and we're like, oh my gosh, well, they're just, that brain and that psychosocial development, we're just screwed? No, absolutely not. And I am aware that I have time limitations, so I'm not gonna go into it, but I do, and sometimes I do give presentations on how do you talk to your teen? How are ways, how can we actually use this to our advantage, how their brains operate? What I can say is, and I work with teens every single day, and I think they're absolutely amazing and lovely and intelligent, and really what they need is knowledge, and they need adults that can help guide them through difficult situations. And that's part of what we're doing here today, getting this knowledge out. They need to know that, right, that taking a pill one time could be fatal. They also need to know that it might not be fatal because that pill might not have anything in it, but the next one does. And so just because you got away with it today doesn't mean that it might not happen again. Because sometimes what can happen, right, is like we give this information out and it's heard and it's like, well, I tried it and it didn't happen to me. Well, this is a whole different ballgame and landscape. And so I just think it's important to mention that. I think I'm going to just leave it at that because there's a lot of panelists and there's a lot of good information and we're going to have question and answer.
Thanks so much, Dr. Hildy, for sharing those thoughts and for doing what you do with the kids in Portland. I'd like to turn it now to Dr. Wright. Dr. Wright, you've been treating kids with drug use problems for a lot of years now. Can you tell me how things have changed since fentanyl took over?
So my story really starts about 5 years ago. I am an addiction doc and I'm also a family medicine doc. And Daybreak Treatment Center over in Vancouver, I needed somebody to come over and do primary care. They treat kids from ages 12 to 18. that have both mental health problems and addiction problems. The problems typically when I started 5 years ago were really pretty mild. They had the mental health problems were things like ADHD, anxiety, and depression. The substance use problems were really too much marijuana, too much drinking. Maybe they got in some trouble with the law. Occasionally the worst was Xanax. I would say, I think I may have seen one kid that was dependent on opioids and he had used heroin. Otherwise, that just wasn't the scene. And then about 2 years ago, it all changed. All of a sudden, the kids I'm seeing are using pills. They called them Perk 30s, they called them blues, and they were not just using them occasionally, they were using them daily, sometimes 5 to 6 times a day, and couldn't stop. This is what changed 2 years ago, and I don't think people realize because it happened so fast. The typical kid at Daybreak is maybe not what you normally would think. They're kids, very sadly, that are a lot like Cal, but these kids are 16, 15. They have already developed an opioid use disorder. It may have started by, perfectly innocently, by taking something from a friend at a party they thought was benign. It may have been given by their doctor. They had their wisdom teeth taken out. You'd be surprised how many kids get something like Percocet after that. So they don't think Percocet's a big deal. And they think these are Percocet. But of course they're not. They're fentanyl. And so I really want to press that point because I think what Anna said is so true. You think it won't happen to you, and parents think it won't happen to their kids. But fentanyl really is different, and people can get hooked on it pretty quickly. And my other point would be that if fentanyl doesn't kill you quickly, it will kill you slowly. So before, when kids were experimenting, not only was the risk low for quick overdose, but it was also low for them to get dependent on something. This is a potent drug. It acts on the brain quickly, and it starts to remodel it quickly. And it can happen way before the parents realize, and kids are just in over their heads. And once they get to this point, counseling isn't going to help. I mean, I think it'll help with the mental health problems, and Anna, please correct me if I'm wrong, but what they really need once their brain has started to be affected is medication. And unfortunately, that medication is not readily available. Only 14% of kids who meet the diagnosis of opioid dependence will even be offered medication. And the early studies show that it is much more helpful. It doesn't just help them get through withdrawal, it helps them recover. It helps their brain heal, is how I describe it to parents. It allows them to participate in their recovery, to reform relationships with friends and family, and to get back on track with their life. They don't have to be on it forever, but they do have to be on it long enough for that healing to take place, and at least for several years for most kids. A lot of kids will try to come off of it in a year, and again, we need more research to know what that time period needs to be. So my take-home points for this group really are a reflection of what you've already heard. Fentanyl is everywhere. It can kill you with one pill, or it can kill you slowly over time as you become dependent on it. If you are dependent on it, you need medication. It can save your life. And we need more research, more education, and more access to care. Thank you.
Thanks so much for sharing that, Dr. Wright. Dr. Englander is a nationally recognized expert in addiction treatment for hospitalized adults. What concerns do you have most about the arrival of fentanyl to our scene here in the Pacific Northwest?
Thank you, and thanks for the opportunity to be here. In the context of this panel and of this crisis, I first really just want to acknowledge Jen and John and Cal's story, which is a heart-wrenching story and one that clearly needs urgent attention and swift action to raise awareness and prevent future tragedies. And it's in that context that I really want to drive home the point that all overdose deaths, each and every one, are preventable. In the United States, there were over 100,000 Americans who died in the last year from overdose. And we know that in Oregon, overdose rates are rising and surpassing the national rise. This number of 100,000 deaths is more, it would have been unthinkable even a few years ago. And in Oregon, we've had a 41% increase compared to a 16% increase nationally. And again, this adolescent group is so critical and so cherished, and represents in Oregon about 12% of people who've died from overdose in the last year, which means that close to 90% of people are 25 or older. And again, each and every death is preventable. And so, you know, as we think about what does that mean, preventability, I really want to reflect on what Tony said, what others have said, which is the need for leadership, the need for strategy, and we have tools that we can deploy. And those tools include awareness, those tools include education, those tools include harm reduction, including widespread access to naloxone. A pharmacist who I love and work with says, carry naloxone like you carry your keys or your phone. Every Oregonian should be carrying naloxone. And there are other approaches to harm reduction that are critically important and often too difficult to access. I also want to speak briefly about the importance of treatment. And by treatment, I mean evidence-based, low barrier, no wrong door, every door, the right door treatment. And treatment includes, for opioid use disorder, medications like methadone and buprenorphine. And Oregon has really terrible access to medications for opioid use disorder. And not only do we have not enough access, but the treatment that we have often makes people work way too hard to access that treatment. People have to stand in long lines, they have to travel long distances, they have to comply with unnecessary rules and regulations, and we can do better. So really, you know, the last point that I want to make as we come together around this crisis of youth and youth awareness is that underpinning so many of the challenges we face, I think, really is stigma. And I think when we think about families like Jen and John's and stories like Cal's, we have an opportunity to peel away that stigma and recognize that every person who's affected by this, which is all of us, is a loved and cherished person. And that may be someone who's experienced a lifetime of trauma. It may be someone that's experiencing homelessness. It may be our neighbors, our kids, our friends. But I think that until we really work to come together and peel away that stigma, I think our progress will be impeded. So again, every death is preventable, and we can do better.
Thanks so much, Dr. Englander. Dr. Buckheid, you train doctors around the Pacific Northwest to treat addiction, and you also direct the Harbor Clinic that provides low barrier access to buprenorphine for people throughout Oregon. Where do you see the gaps in our region?
Yeah, thanks so much, Todd, and thanks to everyone for being here today and bringing up this really important topic. So I think the gaps in treatment in Oregon are huge, specifically in young adults and adolescents. You know, we have very few residential treatment programs in Oregon, and the ones that we do don't offer evidence-based medication to treat opioid use disorder. And I think the important thing to note is, you know, I think that it is sad, it is depressing, the number of people who are overdosing from drugs right now in the US, but we know that there are evidence-based interventions that keep people safe and keep them from using opioids. And so knowing that, we really need to make sure that those interventions that we use regularly in adults that have been evidence-informed and evidence-based and shown to be effective in adolescents and young adults, that they have access to those medications. And it doesn't mean that they have access on the 18th appointment when they go in to see a provider. They need on-demand, same-day, easily accessible medications, or we are going to have worsening overdose death rates in the state. And so ways that we can do that really is to focus on patient-centered interventions. So what's going to work for you? Are you going to need a virtual visit? Do you prefer to come in person? Right? These are things that are going to be very important. And it's interesting that even though the American Academy of Pediatrics recommends the use of medications for opioid use disorder, that very few pediatricians and primary care doctors actually offer that service. And so as a medical community, as a state, we need to be doing more. I think we need to employ a multi-pronged approach to the overdose epidemic, both in the US and in Oregon. We need to educate families, we need to educate students, we need to educate teachers, we need to educate coaches, we need to educate healthcare professionals about the risks of fentanyl so that they can talk to their patients and screen their patients for problematic drug use so that we can catch the substance use disorders early and get them into treatment. We also need to ensure that pediatricians and primary care doctors have the training that they need to prescribe buprenorphine so that our patients have access to this medication so they're not waiting to get these life-saving meds. And then finally, I really think that we need to ensure easy access to naloxone and make sure that everyone in the state knows how to use it.
Thanks so much, Dr. Buckheid. I really appreciate the rich diversity of perspectives around this driving issue. And I would just, if it's okay to put you on the spot, Jennifer, ask you to reflect on how we can bring all of these diverse perspectives back to teenagers and preventing fentanyl complications in teens.
Thank you. Happy to do that. And I think, first of all, I want to acknowledge everybody who's been here and thank you for your perspectives. I think it's important that people know that this is a problem that we all need to work together to solve. This is not something that just the school nurse can solve or that a parent can solve or that we need to rely on the schools to solve, but this is a community-wide effort. And for people who are working with teens, I think it's just important that everybody knows that the drug scene today is much more dangerous than it was in the 80s or 90s when a lot of us were growing up, or even 5 years ago, that with the introduction of fentanyl and other synthetic opioids and drugs, that one pill can kill, and if one pill doesn't kill, the path to addiction and substance use disorder looks very different than it did previously, and it is much, the path to substance use disorder is much shorter and much more complicated. And so everybody needs to understand the risk. I encourage everyone talking to your kids before you suspect there's a problem. There needs to be an open line of communication from a very early age, very open. The kids need to understand the risk, the parents need to understand the risk, talk to your friends, everybody in your community about it, because we know that the knowledge is power, and knowledge can help to reduce the risks that our youth are taking. So yeah, just talk and share, reduce the stigma.
Thank you so much. We have time for media questions right now. If people would like to discuss, or the 9 of us we can keep talking. I can repeat the question.
So you were saying that every Oregonian should be able to have naloxone and know how to administer it. How would I, as a parent, be able to get that and be trained in that? How would a normal person do that?
Yeah, that's a really great question. Here, let me take my mask off. So in the state of Oregon, anyone can go to a pharmacy and ask for naloxone without a prescription, and as part of that, they will be trained by the pharmacist on how to administer naloxone. So naloxone comes in multiple formulations. One of them is intranasally, also known, the trade name is Narcan. So it's a little pack, it looks just like that. I carry that one with me because it's super easy to use. You peel it open, you place it in the nose, and you press down. And then if you're trained in CPR, then you can initiate CPR at that point after calling 911. They also have an intramuscular formulation that you can also get, and it comes with a kit with the needle, and they train you how to administer that. Alternatively, if you know of harm reduction services in your community, needle exchanges, they usually or always have Narcan available for free. And then I would recommend reaching out to your local public health department if you're having any other difficulties trying to access Narcan, and they would be able to point you in the direction as to where you can get it.
Hi, Adrian Thomas with KPTV. My question is for Joni Bush. I am wondering, you're seeing a rise of this problem in schools, and we're looking at teenagers, middle schoolers, high schoolers. If some of them might be afraid to come forward to report something to schools, I mean, it can be the difference. It can be a matter of life or death of somebody coming forward. So how can we, I guess, reinforce the message that if somebody sees something and says something, well, I mean, there's not going to be a huge disciplinary action taken, correct? I mean, what's really the policy like if somebody reports something or somebody is associated with a group who you might see these pills and they're not partaking, but they're in this group and they're worried for their friends.
Thank you. That actually happens more often, is that we have a student's friend come forward to maybe a teacher, to the school counselor, and express that they're concerned for their friend or the activities that this group is participating in, which could be illicit drug use. We have a very warm response to a student coming forward with that information or a student coming forward for themselves. I work very, very closely with our school counselors, our social worker, myself, and we see it as an opportunity to educate the family, and to really find a pathway to help support that particular student, that friend group, but also to increase awareness. It's kind of like that campaign, anti-bullying, right? When you see something, when you hear something, when you see harm to another person, intervene, tell an adult, right? This could be life or death. So we really see that as an opportunity. There are no repercussions. It is simply, again, reducing the stigma is something we are constantly working on, because, now we're able to talk about anxiety a little bit more. We're able to talk about depression. That took quite a few years. The pandemic certainly helped to escalate that conversation regarding mental health concerns. But again, reducing the stigma about talking about drug and alcohol use. Because again, as you guys have mentioned, it's a very different landscape that could be life-threatening for a student who is taking a medication or a pill unknowingly containing fentanyl.
Hi there, Evan Schreiber from K2, and this question is actually for John and Jennifer Epstein. Please correct me on the timeline, you guys, but Cal passed away in December of 2020, and then April of 21, I think was the first time you really told your story to the Beaverton School District. I'm curious what you've learned now, more than a year later, and how the conversation has changed around that conversation you're having with other parents and other families.
Thanks, Evan. Well, what we've learned since we engaged with Beaverton School District is, one, how widespread this is. It's in every state in the country. There's, you know, millions of pills. The dosage is horrible. Kids don't know. Like we learned that we were not an isolated incident, and it was much bigger and growing faster than we thought. That's one. Two is, again, the emphasis that really people don't know. It is either because of stigma, because of the, you know, years of hearing about the opioid epidemic and, you know, consideration, you know, and fear and thinking about it just doesn't apply to me. And it's really something new, this really powerful, inconsistent dose in something designed, you know, designed, manufactured, and marketed to look like something real. And so people don't know, kids don't know, families don't know. Even after this panel and all of the news stories you and others have done, most people are not aware of this. So that was the next thing. And third is the speed at which this message is getting out is glacial. Like big government agencies do not move fast. The drug landscape is evolving faster than the research and the supports and, you know, energy that can be created out of these agencies. And, you know, OHSU is a huge place. This is amazing to bring this together, but for it to trickle out to families, to kids, providers, is just not coming from, you know, the federal government or even really the state very fast. And so that's why this forum is so important. That's why your news stories are so important, and that's why the, you know, Oregon School Toolkit is so important, because we must do more to raise the awareness. And it's, you know, it is obviously a very complex issue, and Jennifer and I have been focused on the youth aspect with the pills, but as you heard from the other doctors and professionals here, if it doesn't kill you, it quickly progresses into a substance use, you know, disorder, a problematic use that if you don't get a hold of it quickly, it creates lots and lots of other problems, and there are solutions to it. So, you know, focus on the front end with prevention, and then if someone gets through that gate, you know, there's medication and resources and treatment, and we need to do more in those places. But we have to educate and get the word out, because really it's not coming from any other place. It's very, very slow. So this work is very important.
And I'd like to add one other thing, is that I think that parents often rely on other organizations to educate their kids on drugs. We assume that the kids are gonna learn what they need to learn in schools or through their doctors. And I think that parents need to not assume that their doctors or their schools have the most updated information and are teaching our kids what they need to know. I think that many doctors do know, and actually I don't even want to say some schools do know what's going on, and some schools are doing education. But the majority of schools in Oregon and the majority of schools across the nation have not addressed this to the full extent that they need to. And so I encourage people to talk to their school leaders and make sure that something is done. Talk to their doctors, talk to their pediatricians, and make sure they understand this, and find out what their pediatricians are saying to their kids. Because I think if we assume that other people are going to talk to their kids about it, people are going to fall through the cracks. We're going to miss people.
Thank you, John and Jennifer, for sharing your experiences. Thank you, other panelists, for sharing your experiences and expertise. And thank you to the members of the media who are really pursuing this issue that's a critical public health challenge for all of us. Today, we've heard three main messages that every family needs to know. Number one, that fentanyl is everywhere right now in our community and schools, and it's going to require all of us coming together to raise awareness so that people know about this. Number two, parents and all of us talk with our kids about the risks of experimenting and taking risks particularly with drugs which are so much more dangerous now than even just a few years ago. And number 3, both prevention efforts and treatment of fentanyl use saves lives. It works, and we need more of it. And we need to make sure that everybody has access to it. So this concludes our media roundtable. Our panelists have offered generously to connect with members of the media for more informal one-on-one conversations if you'd like to stick around for the next hour or so. Thank you so much for coming.